Heart attacks don't just start the day that you feel chest pain. In fact, they start years earlier, silently, inside your blood vessels. I'm Dr. Joanette, and I'm an ER doctor for over 30 years. I'm also a Blue Zone native and the founder of Optimum Health MD, where we don't just help people survive, we help them live longer and stronger by understanding what is happening beneath the surface. In this series, we've talked about how your hemoglobin A1C reflects the speed at which your body is aging. And today, we want to focus on and talk about how it is affecting your heart. In the emergency department, I rarely see a sudden heart attack. What I see are the final chapters of a story that has been written and unfolding now for decades. I remember a patient who came in. He had crushing chest pain and was only 49 years old. He wasn't obese, and he didn't have a smoking history, and his cholesterol was high, but not alarmingly so. He kept saying, "I don't understand. I've always been healthy." And here's what I found when I reviewed his labs over the past about 10 years. I saw a pattern that jumped out. His hemoglobin A1C had been slowly creeping up from the low fives to now the high fives and into the low sixes. It had never been flagged and also never addressed. And here's what an elevated hemoglobin A1C does to your cardiovascular system. Glucose binds to the proteins in the walls of your blood vessel. This glycation process makes your arteries stiff as well as brittle, and they lose their ability to expand and contract. Stiff arteries then increase your blood pressure. They force your heart to work harder, and in order to just push the blood around your body. Now, at the same time, though, that glycation is damaging the delicate endothelial lining that is inside of your vessels, and that lining is where the atherosclerotic plaques begin to form. If you want a deeper look at glycation and what it does, here's a video. Please check it out. Higher hemoglobin A1C also promotes chronic inflammation, oxidative stress, and increased plaque instability. All of this makes the plaque more likely to rupture, which is what a heart attack is, as well as a stroke. And the damage doesn't start when you cross into diabetes. It starts much, much earlier. In fact, research shows that even with the normal A1C range, each incremental rise corresponds to an increased cardiovascular risk. There is really no safe cliff edge. Instead, it is that smooth upward slope towards heart disease. If you were taught that heart disease is only about cholesterol, then hit that like button and answer this in the comments. Has anyone ever explained how blood sugar affects your heart and contributes to heart disease? It's not just about our large arteries either. Microvascular damage matters just as much. Those tiny little vessels in your heart muscle are extremely sensitive to glycation. And when they stiffen and narrow, then the oxygen that's getting to your heart muscle, your heart tissues, becomes less. The result is your heart tissue becomes less resilient, and your ability to exercise will decrease, along with an increase in your fatigue. In the blue zones where I grew up, heart attacks were really quite rare, and they tended to occur much, much later in life. Why? Because we walked daily, we ate simple meals, and we didn't have constant glucose spikes. Also, we didn't snack late at night. Our arteries stayed flexible because our metabolic environment was supported by our lifestyle. This isn't genetics, it's physiology. A stable glucose means less glycation. Less glycation means healthier blood vessels. Your hemoglobin A1C is now considered an independent cardiovascular risk factor. What that means is that it is able to predict heart disease, even when your cholesterol and your blood pressure are in a normal or acceptable range. What it does is it's giving you an early warning long before any symptoms are going to develop. And that's the opportunity, because when your A1C improves, your vascular health is going to improve as well. Your arteries can actually regain some of their flexibility. Your inflammation can decrease, and your cardiovascular risk will drop. At Optimum Health, we focus on prevention, not panic. We look at the trends, not just the thresholds, and we act early when change matters the most. Your heart attack doesn't start in the ER. It starts in your daily habits, and your A1C gives you time to change the ending of your story. Thank you for joining me today, and please share this with someone who thinks that heart disease is all about their cholesterol levels. Also, subscribe, because next we are going to talk about how your muscle mass will protect your metabolism as well as slow your aging.